Welcome all to the part 2 of electrophoresis of proteins. As I have told you that now today we'll have this protein electrophoresis part. We have done the basics and the theory. So when you talk about electrophoresis of protein, we have to think of this evaluation. So first, as I said, that Tiselius has done it on a liquid base. And after that, it was found that this kind of electrophoresis can also be done on a weight page. So there is a paper electrophoresis. But the major problem with the paper electrophoresis is that the separated molecules diffuse very widely and neither it could be visible very clearly. So therefore, there is the medium has changed and evolved one after another, and therefore made the electrophoresis pattern more and more sophisticated and ease to operations. So first, after paper, they came like cellulose acetate, which is a modified version of a paper, which is blended with cellulose acetate. Then they come this another one called SDS page, will come later on. Immunoelectrophoresis, where antigen-antibody reactions can be used with electrophoresis. Then isoelectric focusing, as I was talking to you in the last episode, there are certain conditions, certain pH, the amino acids, they become chargeless because they have equal positive and negative charge, and that particular time they become motionless in an electrophoretic field. This particular point is called isoelectric point or isoelectric pH, and this is by focusing it, we can separate the molecules as per its isoelectric point. Two-dimensional page is another one which actually gets mixed with IEF and SDS page to two-dimensional electrophoresis, where they are separated not on the basis of charge, on the basis of size and shape aspect. Now after that it became more advanced and that becomes a capillary electrophoresis. We'll come later on. First we talk about the cellulose acetate electrophoresis, or is called a zymogram technique. So this is one which can separate protein, like we can do protein electrophoresis here, we can do lipoprotein electrophoresis over here. So cellulose acetate is the first step towards an advancement, where actually the cellulose acetate is poured on a paper-like molecules, it's a filled paper basically. And when it is drawn in a buffer, so it creates a base and as well as a good conductivity medium. And the main advantage of it is that the separation is good and they have uniform pore size. So not that the non-uniform pore size, what happens, through some pore, the molecule finds more resistance and they hinder back of it. With a larger pore, they move faster. So the same molecule cannot be separated uniformly. So in that case, what happens when the pore size is same, the resolution is far better. And also resolution is far better than paper, so that it does not diffuse much. So that is the best one of cellulose acetate. But the major disadvantage of cellulose acetate, why the agar gels are coming on later on as a popular media, is that it's not that transparent. So what happens? Scanning is a bit difficult. Then it is SDS page. Later on, it came as an agar gel electrophoresis. Agar is actually a seaweed, which actually it forms a very gel-like thick strong on the glass plate, and we can use it. Later on, we'll be talking about it. So when protein electrophoresis will come to, but this cellulose acetate is advanced with an agar gel, and now we call about the SDS page. This is a different electrophoresis altogether. It is called sodium rhodecyl sulfate polyacrylamide gel electrophoresis. This is nothing but a coating material. This SDS is nothing but a coating materials. What happens? It first denatures the proteins and therefore creates an uniform negative charge, because it actually covers the ions or cover the amino acids and create an uniform negative charge, because it actually covers and masks the ionization of the amino acid. So therefore, once SDS is coated, this entire electrophoresis, that is migration on the basis of electricity charge, is now totally dependent on size. So the larger one goes behind, the smaller one moves faster, something like that. So the driving force depends now more friction than charge. What happens? It is a negatively charged detergent. It coats protein and disturbs secondary and tertiary structures. Okay, it masks its charge and puts its negative charge on it, and therefore it prevents aggregation, and therefore it is negating charge as the main factor of mobility. It is now the factor of separation is the size. So if pore sizes are very small, then smaller ones will face less resistance, will move forward, larger one will hinder back. So therefore, the mass is the main determinant of different mobility of the molecules. This is what happens is separation of the molecule only for the as per the mass. The immunoelectrophoresis is actually, we first do the electrophoresis to separate the molecules. After the molecules are separated, now we use the antigen antibody formation and precipitation to separate the molecule. That means first it is moved by electrophoresis, the antigens are separated. So therefore, now you create a trough in the side with of antibody. Now what happens? The antigen is separated and finds this area of the antibody and it precipitates here. So therefore, you actually can identify the molecule. First, you separate from the entire bunch of the antigens, and now the antibody trough, this antigen, if it separates and precipitates here, now you can identify this is the antigen-antibody complex, and now you can separate it from the entire molecule. So this is immunoelectrophoresis, means it is immunoassay and electrophoresis in combination. Isoelectric focusing, as I told you, this is a very specialized mechanism, is that first there are certain amino acids which can act in both synthesis called ampholyte, the mixture of amino acids. So it runs the ampholytes first on the JEP. So therefore, the ampholytes create a very small gradients of pH gradient in the entire path. So now you run the molecule. When you run the mixture, each protein, it moves towards as per the charge, and once it reaches that isoelectric point, that means it first created a gradient. That means 0.2, 0.4, 0.5, 0.6. So it created gradient of the pH. And now when the molecule is moving, whenever it matches its isoelectric pH, that means the pH in that condition, it becomes a chargeless molecule with the same positive and negative charge. That molecule settles there only. So after running, you will find each and every molecule found its isoelectric pH and settle there, because on that particular area, that particular amino acid becomes chargeless, or protein becomes chargeless. So therefore, it cannot be moved. So it will fix there, and that is called isoelectric focusing. See how it operates. See, this is a positively charged ion. This is a negatively charged ion. This positive charged ion is there what? When the pH is low, that is acidic pH. Now, when the pH is high, that means alkaline pH, the same can behave as a negative ion. Now, you move electrophoretically, there will be one point when the number of positive charges and the negative charges will be the same. So this is the pH. Suppose a molecule at 4 is a strongly cationic molecule. At 10, it is strongly anionic molecule, but it has got an isoelectric point of 7. So when it reaches the point 7, at that particular area, the molecule has got equal positive and negative charge. That means, as per the electronegativity or positivity, the molecule is 0 at its point. So it is chargeless. So it settles there only. So this is the thing of isoelectric focusing, by which you can actually find out each and every molecule at its isoelectric pH. There is another condition called two-directional electrophoresis using both the molecules. Means, first you use isoelectric focusing. where the molecules are separated as per their isoelectric focus pH and settle there. So here you actually separated from the mixture on the basis of their charge only. Now what happens? See this one. This is what the electrophoresis has done. You have initially placed this molecule here and allowed the run, and they separated as per their isoelectric pH. Fine. You just place it here as the moment, as the point of application, and now run this electrophoresis here on SDS page, mixing with SDS. So what happens after you run this SDS page? This all become masked by SDS. There is no separate no separate charge difference is there. So therefore, they will move as per their volume or as per their mass. So smallest will run faster, larger will get behind. So therefore, the net mixture now will be what? Will be differentiated first on the basis of their charge, then on the basis of their mass. So therefore, you can get the highest separation first by the charge and then reversed it to 90 degree and then you run it by its mass. This is called two-dimensional electrophoresis. Now the advanced mechanism is called capillary gel electrophoresis, which is a more of an automated version now. And the capillary gel electrophoresis gives a faster performance nowadays. And we perform the automation version. The electrophoresis, which takes about 60 minutes time, in capillary it takes about 1.5 minutes or 2 minutes time. So it is more advanced nowadays with a capillary gel electrophoresis. So basic mechanism is all the same. But the thing is that here voltage application is very high and therefore the movement is very fast. Capillary electrophoresis looks like something of that kind, and it can be interpreted with a graphical representation. This is one you have to understand, electroendosmosis. Sometimes we will see some are molecules which are pushed behind the application point. Usually, application point is the first point, and all the molecules runs away from the application point to the other end. Sometimes you will see the molecules are pushed behind to the end of the application point. How it can happen? This happens in case of a electroendosmosis, particularly when you use agar gels and the agar contains impurities. What happens? Some of the cations, they remain here in this gel, and they, whenever the buffer is spreaded, these cations drag some negative ions around it, and the negative ions are very highly charged. So after that, around them there is a cloud of another ion is there. Once you start application, what happens? When you start application here, this is all the positive charge and these are fixed in the gel, so they are unmovable. So they have an ion cloud of negative ion around them. Now this is application and you are expecting the molecules on the basis of the electronegativity, they will push towards the anode. Now what happens? These negative clouds, they start moving to the opposite. The positive clouds are moving to the opposite side because these are the strongly bound negative charges, and around them there are some loose bound positive charges which are freely movable. Now when the molecules are moving, electronegative molecules are moving to this side, there is a counter running of the positive ions on the other side, and sometimes this ion pushes the weak electronegatives towards the cathode. This is a typical impurity, and this can be with agar gel, this happens. So when we actually purify it with a more purified version called agarose gel, this particular endosmosis, they not become very significant. Now therefore, how you stain it after separation, you need to stain and destain. Stain is that with serum we use chromacy blue, amido black and Poncy. For isoenzymes we use nitro blue tetrazonium, and for lipoproteins we use either oil red O or Sudan black. These are the respective nanometers. Here you can read and have a graphical representation of those stain products. Now, when we talk about serum protein electrophoresis, it is serum proteins are negatively charged as a whole as the pH of 8.6, and they run towards anode because they're all anions at the charge of 8.6, which is a I should say the um, basic charge. So, therefore, we use the agarose gel here. We, as I told about this, and is agar is a weed agar, which is particularly make a very transparent gel-like material to make it even more purified and therefore free from other impurities. We create the agarose gel. Nowadays, all the electrophoresis, protein electrophoresis, mostly are done on this agarose gel. Now, the steps of serum protein electrophoresis is that he applied the sample. That voltage is around 70 to 100 volts, run time around 30 to 60 minutes, and therefore you do the staining and destaining and fixation, and then you calculate with the densitometer. So this is the steps actually, and these are the proteins you can separate. Albumin, alpha 1, alpha 2, beta 1, beta 2, and gamma globulins, they are separated like this. The major first moves maximum is albumin. Then as per the mobility, alpha 1, alpha 2, beta 1, beta 2, and the entire large portion is gamma. So this is how it looks like. And this is the separated ones. This is the graph. It is another way of producing a graph. And albumin, as you know, the maximum concentration is there. So it's most electronegative, so it runs faster. And they are mostly very low albumin, usually found in malnutrition, chronic liver disease, ophthalmopathy, etc. Alpha and beta globulins, they are the things we should go as a quick go. Pre-albumins like TBPA, thyroxine binding pre-albumin, retinol binding protein, and also there are others around. In 2 days is a half day of them. They are pre-albumins. Also alpha 1 antitrypsin, which mostly you can find in hepatic cirrhosis, cholestasis, and hepatocellular carcinoma. Alpha 1 acid glycoprotein and alpha 1 alpha fetoprotein, which is particularly present in uterine tube defects and also in liver cancer. You will find it high in number. Alpha 2 are alpha 2 macroglobulins, ceruloplasmin, which is a copper containing protein mainly present in liver, and this is also an acute phase reaction, and measurement is done for screening of Wilson's disease. And alpha 2 haptoglobulin you will find in detection of hemolytic diseases, otherwise it has got nothing significant. Beta are mostly beta to beta transferrin, which is an iron transfer protein, also acute phase reactant. Beta 2 microglobulin, which is also increased in renal failure and malignancy of beta lymphocytes. Complements are also beta lipoproteins like C3 and C4. They are increased in inflammations. Gamma globulins, as you know, mostly are immunoglobulins and C-reactive proteins. And when you find a very sharp single peak in this, it's called multiple myeloma. We'll have a different class on it. We'll not go into details, but monoclonal gammopathy. Usually, gammas are differentiated into 5 segments: IgA or Ig alpha, IgG, IgD, IgE, IgG, and IgM. So it is a polyclonal, which all the segments can have its clones, but sometimes one single clone can create a malignant production of one type of immunoglobulin, and that gives a one short band in the gamma globulin area. We call it a M protein or M band, and that is the pathognomic and the sign of multiple myeloma. So for diagnosing of multiple myeloma in serum protein electrophoresis, presence of M band is very, very highly possible, and very, this is the diagnostic feature of multiple myeloma. So Others are there. CRP is also bound and acute phase proteins. What are the acute phase proteins? Which actually, in case of an inflammation, if it raises, it's called positive acute phase protein. Some decreases in case of inflammation, they called negative acute phase proteins. They are also present in gamma globuli. So it is a short life, more or less. It goes normal to about 7 days. And these are the acute phase proteins you may get. These are C-reactive protein, amyloid, pseudoplasmin. So they are all alpha 1, alpha 2, beta 1, beta 2, and gamma, all contain some kind of acute phase proteins. But these are not of interest when you're doing a serum protein electrophoresis. But for serum protein electrophoresis, our major area of concern always remains around finding a MDAN. Sometimes you will get some high alpha 2 or something. So you will have a separate diagnosis altogether. So limitations of this are positive result may be observed with acute phase proteins found in high concentrations, but hardly they have got a clinical significance. And sometimes smaller amounts can also have a similar significance. But as a whole, we are not concerned about it. We'll come to the interpretations and other parts later on. So there are how you look at it. This is albumin, alpha 1, alpha 2, beta 1, beta 2. This entire thing is gamma. So sometimes you will find a very large peak in gamma region is one monoclonal peak. It is called M band or monoclonal band, which is pathognomic of a multiple myeloma. Sometimes you may get a diffuse band like this, which is a diffuse gamma globulin, which is basically an inflammatory response lead to polyclonal gammopathy. This is not important. You have to understand how to differentiate between a polyclonal gammopathy and a single sharp rise of a M band. So we'll come in the later on the hands-on training and we'll describe it in detail there. So this is follow-up of a monoclonal gammopathy is a big one. I think I don't need to describe it now. So rather we should stop it here and we'll go for the case study and hands-on training on our part 3. Thank you.